Hi, my name is Emma. I'm going to be performing a nasogastric tube on you today. Can you please verify your name and date of birth for me? Okay, thank you. Okay. So I'm going to start by asking you a couple questions. Have you ever had a history of stomach complications, have a history of nausea, anything like that? Okay. Have you ever had an NG tube placed before? No? Okay. Well, I'm going to go ahead and explain what it is. An NG tube is just a tube that's going to go down your throat and into your stomach, and then it's going to take all of your stomach contents that you can't pass, and it's going to go right into a suction, so it's going to make you feel a whole lot better. If at any point you do feel nauseous during this procedure, I do have a little basin for you. Have you ever had surgeries pertaining to your throat or your stomach? No? Okay. I'm gonna check your patency real quick. Can you take a deep breath? Okay, that looks good. Okay. And then at this time, I would also assess for bowel sounds, and I would do some palpation just to make sure that the patient's stomach is not tender or anything like that. It doesn't appear that the patient has a chest tube in, so I'm going to go ahead and get started. Okay. And because this is not a sterile procedure, I do not have to use sterile gloves. I'm gonna check your mouth real quick just to make sure. Can you say, oh, okay. You feel it looks good. Okay. So to go ahead and start out, I'm going to, I need to make sure that the tube is lubed up before I insert it, and I need to measure before I do that. And then I'm gonna curl the tube around my finger about 5 inches, so it just goes down easier. Okay. Are you still doing all right? Okay, great. Okay. So I'm going to go ahead and measure it before I insert. So I'd go ahead and take the tip, and I would measure to the ear. Go ahead and get on this side of me. Measure to the tip of the ear. Okay. Can you see that? Okay, great, thanks. I'm gonna go all the way down to the xiphoid process. Okay. And it's at about 52, and then I take a couple inches, so it's gonna be around 55 for my insertion. So I'm gonna go ahead and mark that. Gonna do about 3 to 4 inches. And then I'm gonna go ahead and tilt the patient's head all the way back. And these mannequins are kind of hard. Okay, so I would just verbalize that I would tilt the head back and make sure that the patient can get access down. And then I'm gonna have my pen light ready. And then I'd go gently towards the ear, again with the patient's head tilted back, towards the ear. And then at the point where I could see that it is past the throat, these mannequins are pretty hard to open, but at the point where it would be past the throat, then I would have patient tilt his head forward. And sips of water. So patient would have sips of water ready. Okay. So again, I'd be patient is gonna lean forward. Okay, sips of water would be administered. I'd have another nurse with me. Okay, and then at this point, since it is up to the tape that I marked around his xiphoid process, sips of water. Does he feel nauseous? If he does, throwing up. Okay, and then we'd go ahead and get some tape. Oops. Okay, just gonna administer tape right around the tube, making sure it is secure. Okay. And tape is here. Okay, now that we've secured it, or it's gonna be secure, I'm not gonna puncture the tube, but we would secure it to the gown. Okay. Okay, and then we need suction blue to blue. Now that it's clamped, there's nothing that's going to be coming out, but normally we would attach it right up here, have it turned on, and then we would turn it on and it would suction out. And then what's going to happen is I'm going to measure the pH. I would normally measure the pH with, I would take some I'm gonna verbalize. I would take some of the pH out from the tube. I would measure it with this guy, and then I would make sure that the pH is like in between 5 and 6. There's the pH. And then while all of this is happening, after I've had the nasogastric tube inserted, I would make sure that my patient is speaking clearly and can breathe well and everything like that, and does not have difficulty swallowing. And then, let's see, and I'll make sure that he can swallow again. This would be sectioned up, and this would now